Yes, sir.
Okay. Alright, what might be the most horrifying phrase for a young sexually active male? Probably when he gets a phone call saying I'm pregnant. And for a female girl who's sexually active, probably seeing a positive sign on the birth meter. Today I'll be walking you through the steps of what girls must go through when getting an abortion. For the past few weeks I've been researching abortion, and I've gained a lot of knowledge and information on this subject. Since the 1950s, sexual activity has increased in America, especially amongst teens. With the use of contraceptives such as condoms and birth control pills, more teens are having sex, which also will increase the risk of pregnancy because these pills and the condoms are not 100% safe. Thus, this information on abortion could be beneficial for those of you who are sexually active. So today I will discuss the risks, methods, costs, and the legalities of abortion. First, I will discuss the legalities of abortion. Abortion was made legal in the U.S. in 1973 by the Supreme Court ruling in the Roe v. Wade. This states that women have the right to privacy under the Due Process Clause in the 14th Amendment, which made abortion legal in all the states, but the ruling varies from state to state. Currently in California, abortion is legal, and for minors they do not need parent permission, and minors would be under 18. They do not need parent permission in California, while other states you might not need parent permission, but you have to notify at least one parent that you are getting an abortion, whether or not they consent. Second, I'd like to explain the different methods of abortion. Many people are aware of what an abortion is, but they don't know what methods are used. Depending on the development of the fetus, there are different methods. These are suction aspiration, dilation and curettage, dilation and evacuation, salt poisoning, prostaglandin chemical abortion, hysterotomy or cesarean section, and partial birth abortion. During the first 12 weeks, this is a picture of the suction aspiration method. Those are body parts. It's dismembered. So during the first 12 weeks, the most common method is the suction aspiration method. General anesthesia is given and the cervix is dilated. A suction curette connected to a vacuum, which is 29 times more powerful than your regular household vacuum, is used. It's inserted into the womb and it tears the fetus or the placenta into pieces. Then they're sucked into the tube and then they're pulled out. The dilation and curettage is similar, but with the addition of a hooked knife, and it cuts the fetus in pieces and then they carve the pieces out of the womb. After 16 weeks, salt poisoning is used. And this is the image of after salt poisoning. So after 16 weeks, this is used, and a long needle is injected through the mom's abdomen into the baby's sac with strong salt poison. This poisons the baby and acts as a corrosive, burning the outer layer of the skin. Along with this method, the dilation and evacuation can also be used. And instead of a knife, like in the dilation and curettage, a pair of forceps is inserted into the womb to grasp a part of the fetus, and the forceps tear the bone of the unborn child until the fetus is totally dismembered to be removed. At 24 weeks, the prostaglandin chemical abortion can be used, and this is shown here. This form of abortion uses chemicals which causes the uterus to contract intensely, which is more violent than normal contractions that a mother would do during labor, pushing out the baby. The contractions are more violent, so unborn baby is frequently killed. So this is an image after the mother has had contractions, which has killed the baby because they're so violent, and this is the aftermath of what the baby looked like. Another method is the C-section. This is, instead of the labor where they pull out the baby, they'll cut open the womb, and they'll cut the umbilical cord, which would cut off the oxygen supply to the baby, and thus the baby would die. Or sometimes they will just remove the baby alive and then put it in a corner to die alone, which is shown in this picture. They left the baby here after it has no oxygen, so it would die. Okay. And at 30 weeks, partial birth abortion is used. There are 5 steps in this method. The first step is guided by ultrasound. The doctor, guided by ultrasound, he grabs the baby's leg with the forceps. In the second step, the baby is pulled into the birth canal. With the third step, the abortionist delivers the entire body of the baby except for the head. And in the fourth step, the abortionist jams scissors into the head. And then he opens the scissors so it would widen the hole inside the head. And then they have a vacuum and they suck out the brain so the skull would collapse. So this is a picture where the baby is being pulled out and the head is left in right here. And these 4 steps are used to poke a hole. Now that I've explained the different methods used in abortion, I'd like to discuss the risk of these procedures. An important factor every woman must know is that there are chances of harm that will be done to their bodies. Some complications might include heavy bleeding, which can also be known as hemorrhaging. Infection is also possible from the medical instruments used, and damage to the cervix by also the instruments, scarring of the uterine lining, and damage to internal organs such as bowels and the bladder. These injuries and harm done to the bodies aren't that common, but they can happen, so that's something that the woman should know. Lastly, I'd like to describe the cost of an abortion. While being aware of the risks of abortion is important in a decision that the woman must make, costs are also crucial. Here are also important factors that contribute to cost. First, depending on how far the baby has developed, it can affect the cost of the abortion. For abortions within the first trimester, because there's 3 trimesters in the development of a baby, it can be up to $500. In the second trimester, it can come up to $1,000, and in the third trimester, it can cost up to $3,000, and this is from the Women's Medical Center, an online website. Insurance can also cover the cost of abortion. Since every policy is different, you should call your company and ask if they pay for what is called an outpatient elective abortion. The types of anesthesia can also affect the cost. If you use a local anesthesia, it's the cheapest cost, but when you choose to go general anesthesia, which numbs your entire body and puts you to sleep, it can cost $125 to $150 more. And this is also from the Women's Medical Center. So, in conclusion, that was my discussion on the legalities of abortion, the different methods used, and the risks and costs of abortion. Oftentimes people overlook abortion because it is not something that has happened to them yet in their lives, whether it be if you're a girl or a male who has a partner who has developed a baby. But however, as a sexually active person, it is extremely important to know what you must go through when you are going through an abortion, whether or not you are female or male. It's also important to know that there are risks in this process, and you can always get pregnant without or with the use of contraceptives. I hope you have gained more knowledge on this subject, and thank you for your time.